Africa and England either. Right. What I'm going to be speaking to you today about is customized compounding, what we're experiencing practically in South Africa, and with particular application to cosmetic ingredients. Compounding, basically, so for those of you that don't know, is the individualized making of a medicine for a patient. You might want to give more of one ingredient, less of another. You might want to give a substance which normally is taken orally, transdermally, so that you bypass the first-pass metabolism. Or you may, out of patient compliance, want to mix different ingredients together. And that's called a compounded medicine. It's individualized for a particular patient. And these sort of medicines are made in compounding pharmacies. Okay, so compounding is the manufacture by a pharmacist of a gel or a cream, but it can be a capsule or a troche or a nasal spray for a particular patient with a combination of pharmaceutical ingredients. It doesn't always have to be pharmaceutical ingredients. It can sometimes be a combination. So, for example, you may want to recommend giving metformin with vitamin B12, because one of the negatives of metformin is that it depletes B12. And you have to give very high doses of B12 because the mechanism by which it does it is to inhibit the absorption of B12 at a mucosal level. Or you might want to give coenzyme Q10 with a statin medication, because, of course, statin medications flush out coenzyme Q10. So a compounded medicine is not always a pharmaceutical. It is sometimes a nutraceutical, and it can sometimes be a cosmetic or a cosmeceutical. These are, when one deals with a compounded gel, in other words, a transdermal medication where you're wanting to apply whatever the medication is, let's say a hormone, into the bloodstream, you normally incorporate them into things called organogels. Organogels, I'm just watching the time here, make sure I take note when I started. Organogels are unique gels that work as a Trojan horse. Basically, the main function of the skin is to act as a barrier, so that you don't absorb every single bacteria or every single toxin that you come across in your day-to-day living. And the healthier the skin, the more of a barrier function this presents. And in fact, that's often a problem with cosmetic ingredients, is that as the skin becomes healthier through exactly what you're wanting to do, improve the condition of the skin, the thickness of the skin, that skin in the process starts resisting the very therapy that you're trying to apply. The advantage of liposomes, they act as Trojan horses. You don't realize that there are medicines, or the skin doesn't realize at least, that there are medicines or cosmetics inside the cream that must be resisted. Because those cosmetic ingredients or medicated ingredients are hidden inside liposomes. And the liposomes are basically made through a very high shear process where one takes water, fatty acids, and lecithin, and you dissolve your active ingredients in the appropriate phase. So, for example, if you wanted to administer propranolol transdermally or nifedipine transdermally, you would put it into the aqueous phase. If you wanted to administer a bioidentical hormone, you'd mix it into the lecithin fatty acid phase. You then mix them together with high shear using a emulsifying agent like pluronic. And the result is that you get this liposome, which the skin thinks is a skin cell. And as a result, when it's applied to the skin, it is absorbed quite rapidly through the skin into the systemic circulation, at least when it's applied peripherally to parts of the body like the abdomen or the wrist or the shoulder area. And you can see this description here. On the interior of the liposome is water, and all the water-soluble ingredients are incorporated into it. And the middle layer is the lipophilic layer, and that is where your fat-soluble ingredients are incorporated. So you can actually incorporate multi-solubility components into one dosage form, and they are hidden in these liposomes. One of the tricks is, of course, to use high shear, in other words, a very high-speed blending mechanism, so that the liposomes are small enough to be transdermally available. So, why do we develop liposomes in the first place? Why are they there? The reason we develop them is bioavailability exclusively. You know, there's a trend in transdermal application of medicines or cosmetics to presume that because something is applied to the skin, that it's absorbed into the systemic circulation. And I mean, we've had problems in South Africa where we've put hormones into just any cream. They've got a relative bioavailability of 0.1 or 1%. So you're getting a great subtherapeutic dose because all the hormones are sitting on the surface of the skin and aren't penetrating into the skin. Hence the reason that one incorporates these things into bioidentical, into liposomes. And the second thing is, if the second reason one looks at liposomes is that they allow for the delivery of cosmetic and aesthetic medicines. In other words, medicines that work aesthetically for looks, for appearance, into the skin by bypassing the skin's natural barrier function. And this is particularly important as the skin becomes healthier and healthier. It's a similar mechanism you might imagine is the skin needling technique, where you pierce the skin, and that allows not only causes micro damage to the skin cells, causing new skin growth, but allows penetration of the active ingredients into the dermal layers of the skin. Liposomes do the same, have the same effect. Let's first look at the safety and stability of liposomes. Bearing in mind these are things that are normally manufactured in a compounding pharmacy, and therefore one's got to be sure that the recipes that you are making are in fact stable. They have no harmful effect when applied. The biggest side effect you notice is 1 to 2% of people report erythema or rash, and this is particularly so on the face. So before you recommend liposomal cosmetics for skin regeneration or for cosmetic effects, anti-wrinkle effects, etc. on the face, it's important to tell the patient that it could cause sensitivity and to apply it quite sparingly. Interestingly, this is a bit of a study that we're doing, or a project that we've got going in South Africa at the moment, is looking into the whole concept of transdermal mesotherapy. Because understand liposomal gels are made out of lecithin as their base, and we're investigating using the single component of lecithin. Lecithin is made out of a whole lot of phospholipids: ethanolamine, phosphatidylserine, phosphatidylcholine, and we're looking at making a pure phosphatidylcholine lecithin for its possible effects on fat burning, and then one can incorporate into those liposomes of pure phosphatidylcholine, which are hopefully transdermally bioavailable, the incorporation of other actives, things like T2 or there's a whole lot of other ones. Okay, systemic absorption of actives is negligible when formulated for aesthetic purposes. Typically, for aesthetic purposes, the dosage is often lower than what you'd want to administer systemically. And there was a study done using liposomal lignocaine. Lignocaine and your local anesthetics lend themselves very nicely to transdermals, because you penetrate into the tissue quite quickly without too much rubbing or too long an application. And here, with a 4% liposomal cream, where the risk of lignocaine systemically is, of course, increased heart rate, tachycardia, it can be quite a problem, where they applied 30 to 60 grams at a time, there were no side effects noted. Similarly, when your prescription cosmetic creams, estradiol and estriol, were applied at 0.01% estradiol and 0.3% estriol, there were no notable increases systemically when applied to the face of those hormones, except the prolactin increased. And that's another thing I'll be speaking about now, is the trend for dermatologists and plastic surgeons to investigate prescription cosmetics. Using hormones, using progesterone, estriol, estradiol, even DHEA for their cosmetic effects, surface effect. And of course they're stable and resist bacterial infection and contamination. That's assuming that you make them properly, you make them according to recipes that are published in Pharmacopoeia and inside pharmaceutical journals, compounding journals, that you get it right. Remember, preservatives are preservatives are pH. They act over a narrow pH range. So you can't assume that a certain preservative is always going to work if you're going to suddenly add alpha-lipoic acid or vitamin C, which are acidic and can take the pH range right down. So you must obviously bear that in mind in the compounding procedure. A couple of ones that I want to quickly touch on in terms of the active ingredients that we're having good success with, and also where the literature is reporting benefit. And from a prescription point of view is estriol. In studies that have been performed, estriol, there was an increased skin thickness, a reduction in fine lines and wrinkles, improvement in elasticity, greater vascularization, increased moisture content. And in one study with 59 women, there was on average between a 90 and 100% increase in skin elasticity, firmness, moisture, and a reduction in wrinkle depth.